I'm Lisa, a registered nurse here with Precision Advanced Specialty Healthcare. Today I'm going to demonstrate for you how to do IV fluids at home. When we see you in the hospital to teach you, we will bring a teaching sheet, very similar to this one. It will show all the supplies you need and go through the steps of the infusion process. You will need to gather your supplies. First, we need our IV fluids, whatever is prescribed to you by your doctor. You'll need the IV tubing, an alcohol swab, and a saline syringe. To begin, we're going to get our IV fluids ready to infuse. The bag will open. At the bottom here, you have a tab. This is where your tubing is going to attach. Anytime that you're going to be preparing supplies for an IV infusion or touching your IV line, please make sure you have washed your hands really good with soap and water and that you've put on gloves. We're going to take out our IV tubing. Some paper tape around this. Take all of that off. Now, to attach our IV tubing to our IV bag, we want to make sure that we don't contaminate the tip of the spike, and we also want to make sure that we don't push the spike in at an angle where it will puncture our bag. So we're going to pull this tab off of our IV fluids. Then we're going to take, and it's okay to set the bag down at this point because it will not leak. We're going to take the protective cap off of the spike. This spike is sterile, so you want to make sure you don't touch that spike. We're going to press this spike into our IV bag. We want to push it in and twist and turn until the spike is completely inside the bag. Once we have the spike in, we want to make sure that the dial flow on our tubing is in the off position. We're going to hang our bag on our pull. Just press the chamber a couple of times to make sure a little fluid has entered your chamber. And then we want to prime the tubing with our IV fluids. On the end of your tubing, you will have a dial flow. The off position is marked, and then there's numbers that tell you how many milliliters per hour all the way up on the dial flow. We want to prime our tubing, so right now we're just going to turn our dial flow on to allow our fluid to go down our tubing all the way to the end of the tubing. You want to make sure that the tubing is completely primed and that there's no air caught up in the tubing. If you have to increase the rate to get it to completely prime, that's perfectly okay. Sometimes you may have to lower the tubing down so gravity works, but you see it's completely priming our tubing. Once it gets to the end, we're going to turn it back to the off position. We made sure that it primed all the way down to the end of our line. This part of our IV tubing is sterile. We want to keep that from being contaminated. So I'm going to open this up just a little bit and make sure that it comes completely out. Okay, let's pick up where we left off. We were priming our tubing. Right now, our dial flow is in the off setting. I'm going to take the little protective cap off the end of our tubing for a minute, making sure we don't touch the end. We're going to open up the dial flow to make sure that we have some drops come out and it's completely primed with no air. Then we will put the dial flow back in the off setting and put our protective cap back on the end. Now we're going to connect our IV fluids to our IV line. We will need a flush with one saline. The saline opens by tearing the perforated edge. pull out your syringe, the top unscrews and you pull it off. There's a little bit of pressure on the syringe and some air in the top. We need to make sure we break the seal and get the air out. So we're going to use our thumb, press up on the bottom of the syringe until we feel a pop, and then pull down until we see the liquid out the top. The shape of this allows us to be able to set this on our clean, dry surface and it will not contaminate it. You're going to pick up the end of your IV line holding at the hub. Take your orange swab cap that's protecting the end off. You're going to clean the end of your IV line with an alcohol pad. We want to make sure to clean all around the grooves on the sides and in the center. We call this scrubbing the hub. You want to make sure that you use some pressure and that you hear a squeak. You want to clean it for 10 to 15 seconds, all around the side and in the center. Then we want to flush our IV line with our saline. We're going to connect the saline by pressing the saline into the hub, the spongy part in the middle. Just push in and turn. Push and turn. Then we're going to flush with the saline, pushing this black plunger all the way down to that black line. You can just do that with a steady pace. Once we have flushed our IV line, now we're ready to attach our IV fluids to our IV line. I'm going to disconnect that syringe, pick up my IV tubing and take the protective cap off the end. Attach this just like we did the saline syringe. You're going to press in the center and turn to the right. You want to make sure it's snug so that it doesn't leak. Once that is connected, you want to make sure all the clamps on your tubing are open, and then we're going to dial our IV fluids to the rate into which your physician has ordered. If your physician orders your IV fluids to go over at 100 cc's per hour, then we will dial our dial flow up to 100 and it will start dripping. Sometimes your IV fluids will be ordered as bolus, meaning that they can go as fast as we want them to go. In that case, we're going to dial the dial flow all the way to open and it will infuse as fast as it can through your IV line. We will make sure that you know how much IV fluid has been ordered for you. When your IV fluids are finished, you're going to turn your dial flow back to off, and we're going to disconnect your IV line from your hub of your IV. You will want to make sure you flush this when you are finished, just like you would flush your IV line any other time. So you're going to clean the end to make sure that there's no residue. Clean that off, and then you will flush with a saline, flush with a heparin, and put a new orange swab cap on the end.